What is menopause? Are you curious about what really happens during menopause and why menopause affects every woman differently? You're in the right place. I'm Dr. Kay Bloom, founder of the Life Bloom Menopause Institute. Whatever gender you were assigned at birth, we all have androgens, estrogens, and progesterones as our reproductive hormones. These are produced in your testes or ovaries, pituitary gland, and even fat cells. For males, testosterone is their driving hormone. Testosterone is an androgen. Androgens are responsible for the development of facial hair, deepening of the voice, and muscle growth. These are the stereotypical male features. For men, testosterone levels slowly decline as they age, generally starting somewhere between age 40 and 55. But this decrease is so subtle that most men don't even notice. For women, it's a completely different story. For women, estradiol is the driving hormone. Estradiol is an estrogen. Estrogens are responsible for breast development, widening of the hips, onset of menstruation, all the stereotypical feminine traits. The fluctuations in estrogen that come with age have three distinct phases, and these are the three stages of menopause. The first stage is perimenopause. The average age for perimenopause is 42, but it can wildly vary as early as the mid-30s. During this time, our ovaries decide to do their own thing. Working overtime 1 minute, taking a vacation the next. This causes wild fluctuations in both estrogen and progesterone. When estrogen levels are too high, we can experience weight gain, headaches, fatigue, even things like painful fibrocystic lumps in our breast. Estrogen drops too low, we experience hot flashes, night sweats, mood swings, trouble concentrating, and dry skin. The most notable symptom is irregular periods, sometimes with heavy bleeding. The second phase is menopause. Menopause is that moment where you've gone an entire year without a period. That 365-day mark is the day of menopause. Everything before that is perimenopause. Everything after is postmenopause. But there's a problem. Remember how estradiol is the most important estrogen for women? Well, it turns out that both men and women need estrogen. We have lots of estrogen receptors in the brain. These receptors play various roles in regulating mood, sexual behavior, body temperature, and mental functioning. So menopause is about far more than discomfort and hot flashes. Low estrogen levels over time can lead to serious long-term health effects, such as osteoporosis, where our bones become fragile and more prone to fractures. There's also risk of memory loss and cognitive changes, which is far more than just forgetting where we put our keys. This is about potentially facing long-term difficulties in concentrating and memory retention. And you could even face an increased risk in heart disease and various forms of cancer. And this is why menopause is a big deal. And this brings us to postmenopause. Postmenopause is exactly that, everything after menopause. During this time, there are options for women to help mitigate the long-term health effects of low estrogen. However, many come with side effects, and not all options are viable for every woman. The most popular option is the estradiol patch, which may or may not be used in conjunction with progesterone. This is known as hormone replacement therapy, HRT. Balancing hormones after menopause is tricky. And this is because even if you get your dose of estradiol estrogen correct to mitigate the long-term health effects of low estrogen, there's still progesterone to worry about. Progesterone levels aren't regulated. It can cause symptoms like tender breasts, weight gain, headaches, insomnia, mood disturbances, and in the long term, it can cause increased risk of endometrial cancer, blood clots, stroke, thyroid dysfunction, even autoimmune disease. What's next? Well, here's your action plan. Imagine trying to solve a puzzle where the pieces keep changing shapes as you make the puzzle. That's what it can feel like to be balancing these hormones. Remember, you are not alone. You have our entire Life Bloom community behind you. And we're here to give you the tools you need to not just get through menopause, but to thrive. And to do so, we have 3 things for you. First, we have a free guide that covers treatment options for the 5 most common menopause symptoms, linked below. Second, I invite you to join our menopause community, the Bloomer Brigade. Here you will find lifelong friends, women like you, women like me, turning menopause into the best years of our lives. Third, if you really want to dive into menopause with clarity, confidence, and community, I invite you to apply to the Transformative Life Bloom Menopause Masterclass. You'll find all these links below. Remember, you're not alone in your menopause journey. You have our entire community behind you. Thanks for watching.